We're all getting older, but do we have to get old? Canada's population of older adults is growing 4 times that of the total population. Currently, our healthcare system is based on treating individual diseases as they appear, but this approach will become less and less feasible with an aging population, as over 30% of older adults in Canada live with more than one chronic disease. There's a need for new screening approaches to identify those at elevated health risk so that interventions can be put in place to restore health before the onset of illness. Biological function declines with age, but this decline is not experienced the same by everyone. Some people are vulnerable to stressors and face a more rapid decline, leading to poor health. This accelerated biological aging is called frailty. When asked to imagine what a frail person looks like, most of us imagine an older person walking slowly, and that person probably is frail. However, it's more accurate to think of frailty as a range of scores from 1 to 3. Not frail, pre-frail, and frail. Now, this is relevant to all of us, because my research has shown that even those in the early stages of frailty, pre-frailty, are at increased risk for chronic disease. My thesis, which is the largest clinical study ever to be conducted at the St. Boniface Hospital, examined associations between pre-frailty and cardiovascular disease risk factors in 850 women 55 years and older. Frailty was assessed with the use of a simple walking test, hand grip strength test, and questionnaires, making this validated method easy to implement in a clinical setting. This testing identified over 25% of our cohort as being pre-frail. Upon examining the data, non-frail and pre-frail participants both had a median age of 65 years, exactly the same age. Yet the accelerated biological aging of pre-frailty was associated with higher blood pressure, higher levels of depression, worse cardiovascular fitness, and more sedentary time. These all significantly increase risk for cardiovascular disease. During this presentation, we will all have become 3 minutes older. As the years progress, some of us will age faster than others. It is critical that we find means of maintaining quality of life and health. My research has identified novel associations between pre-frailty and cardiovascular disease risk factors. This information will enable individuals and healthcare providers to identify interventions to restore or slow the progression of premature biological aging. In the words of George Burns, you can't help getting older, but you don't have to get old. Thank you.